welcome you to our module, Chronic Kidney Disease, HCCs 136, 137, and 138 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of chronic kidney disease. At the end of this module, the learner will be able to describe chronic kidney disease and its cause, identify the criteria by which the disease is diagnosed, note the ICD-10 codes that fall under chronic kidney disease, assess the documentation of chronic kidney disease. Chronic kidney disease, or CKD, is a long-standing progressive deterioration of renal function. It is a common condition, often associated with aging. In the United States alone, more than 30 million people are living with chronic kidney disease. There are usually no symptoms in the early stages, hence it often goes undetected and undiagnosed until it reaches a critical point. There are many causes which can be attributed to CKD, and often it is a result of accumulation of different conditions and problems which put a strain on our kidneys. Some common causes of CKD can be hypertension, glomerulonephritis, and diabetes mellitus. The stages of chronic kidney disease are measured by the glomerular filtration rate, or GFR, which is measured in milliliters per minute. GFR estimates how much blood passes through the glomeruli each minute. When the GFR is low, it symbolizes a higher stage of CKD. In total, there are 5 stages of CKD. It is important to remember that GFR results must be abnormal on 2 consecutive labs more than 3 months apart in order to properly stage CKD. Only stages 3, 4, and 5 trigger the HCCs, as in these stages, the kidneys are severely damaged and even fail completely. Here is a list of the different ICD-10 codes which are attributed to the different stages of chronic kidney disease with their HCC values. For stage 3, when the GFR is equal to or between 30 to 59, the code is N18.3, HCC 138. For stage 4, when the GFR is equal to or between 15 to 29, the code is N18.4, HCC 137. For stage 5, when the GFR is below 15, the code is N18.5, HCC 136. Remember that for the final documentation, GFR solely is not sufficient. The document should include staging in order to be coded to a specific stage. The assessment and plan should address the diagnosis and include 2 support indicators. An example of the progress note can be written as patient name, Katie Hopkins. Date of service, December 16, 2018. Date of birth, January 12, 1987. Progress note. Patient has CKD3 with recent lab showing improved GFR from 40 to 50. Continue to monitor. CMP labs in 3 months. In this evaluation, we have described the stage of the CKD and the GFR rate. Through this, we can attribute it to the ICD codes and their HCC values. We have reached the end of our refresher course on chronic kidney disease. We learned about the causes of the disease, introduced the various stages, and defined the glomerular filtration rate. We also identified the HCCs attributed to CKD and reviewed example documentation from a progress note. Thank you for joining us.